Thank you all for joining us today. Thank you to nurse.org for sponsoring and promoting this event and for providing lunch and the Starbucks gift cards that you all should have received in your email. And thank you to WHO's Nursing Now for helping to get the word out about the event as well. My name is Rose Hayes, and I'm Director of Engagement for Emory School of Nursing. And we are so proud to be sharing this forum with all of you, with Nurse Alice Benjamin, our guest lecturer, and with our panelists, Dr. Alexis Dunn Amore and Dr. Hope Bussenius, who will introduce more formally when we transition into the panel part of the program. Thank you all for showing up to explore an often overlooked but critical skill set for nurses, how to harness the power of media to drive real change in healthcare. We're going to share tactics today, take questions, and learn unexpected tips and tricks for connecting patients and communities with the health knowledge they need to not just survive, but to thrive and lead happy, healthy lives. Whether you are a student, provider, researcher, professor, or leader, you can be more effective if people understand what you're doing and why it matters. And that's where friends in the media can really help. Because you need to be able to tell your own story and have people listen. Healthcare providers tend to think of media, marketing, and communications as things that are specialized or separate from life-saving work. But if you're carrying essential information that people should know about, wouldn't you want to tell as many people as you possibly can right now? Wouldn't you want to share it with thousands or millions of patients and families if you could? The reality is that everyone in the audience today can, even if you don't realize it. Everyone here is qualified to write a guest editorial or an op-ed or pitch a feature to a national outlet. And yes, that type of content can and often does reach millions of people. So each of you stands to take whatever you are passionate about and translate it into messages that can change the world. Today, we're going to hear from 3 nursing media powerhouses, and they are going to share how they've been able to reach patients and communities through the power of media. I'll introduce our keynote speaker first, and again, we'll bring up and introduce the panel in the second half. Nurse Alice Benjamin, also known as Nurse Alice, is a cardiac clinical nurse specialist and family nurse practitioner with over 23 years of healthcare experience. When she's not saving lives, Alice works as a TV media health expert. She is a regular contributor on NBC Los Angeles and has been featured on The Doctors, Dr. Drew, CNN, HLN, and BBC, among others. And in December 2020, she actually interviewed Dr. Anthony Fauci. Alice is the Chief Nursing Officer and the Chief Correspondent for nurse.org. And before I hand the mic over, I would just like to say a quick word about our sponsor, nurse.org, as well. Nurse.org and their affiliated sites are trusted blogs within the nursing community. They are read by more than 1.4 million users every month, and they engage 30+ million people on social media. Their podcast, Ask Nurse Alice, hosted by Alice, of course, has ranked in the top 9 in Apple's medical category, the Apple Podcast medical category. So please join me in thanking nurse.org and Nurse Alice by giving them both shout outs on social media. You can use their handles as well as the hashtag #TheRealNursingShortage, which is their current spotlight campaign. So thank you so much again, and I'll hand it over to Alice now.
Thank you. Thank you, everyone. I'm real excited to be here. I'm actually from Los Angeles, so I'm visiting. I'm so glad to be finally visit the campus. I've heard so much about it, and Rose has been wonderful. We interviewed you about the school previously, and so it really, I'm really excited about sharing important health and wellness messages, things about the nursing profession, nursing schools, and I'm partial to nursing because obviously I'm a nurse. But I think it's very important to raise awareness to what nurses do, the different fields that we can enter, the type of work that we're doing, and even highlight the nursing schools and nursing education, because as you know, there's a lot of work to be done. We need a lot of resources. Because of COVID, we've seen a lot of things transition, nurses being more vocal, nursing students being more vocal. And one way to help bring about change is to educate people about change. So I want to thank Rose and the school for having me as a guest and being a part of some of the work that we're doing. So Rose already gave me a wonderful introduction. Thank you. I will pay you later for that great introduction. But basically, I've been a nurse for 23 years. I know it doesn't quite look like it, but I have. Right out of high school, I became an LVN. LVN, RN with associate's degree, RN with bachelor's, master's, and I went back for my postmaster's for my FNP. So I knew early on that I wanted to be a nurse, helping people. And as nurses do, we help people predominantly at the bedside, but we know that we're in so many other areas and so many other communities. We do a lot of patient and family education. And somehow I've been able to take this very unique ride into media. So if you would have asked me 23 years ago, Alice, could you imagine yourself on television doing what you do at the bedside, which is patient family education? I would have never imagined that, because quite honestly, we don't see nurses doing that very often. We see physicians. So, and I'll share a little bit about my journey, because it was a pretty rough journey, because I didn't quite have a nurse template to follow. So I was a little over here, a little over there, but deep down the passion was I wanted to educate the communities. I wanted to educate the patients and families, and also do it in an environment where they're more apt to learn the information. Because when they're in the hospital, they just want to get discharged. My ride's here, where's the wheelchair, I'm ready to go. And so, even when we do education there, we need to do continuing education to keep them out of the hospital. So where does that really occur? In their 15-minute doctor's visit, or our 15-minute nurse practitioner's visit? Not all the time. And we have to be cautious about our Google doctors. So that's one of, right, believe me, I get a lot of questions. Oh, well, on Google it said, but anyway, so this has been my journey. As an advanced practice nurse, volunteering with the American Heart Association and AARP. So as doing volunteer work, this is actually how it started. I was at a community health event teaching people about blood pressures and how to be heart healthy, and no one wanted to get their blood pressure taken. And here I am being animated and just trying to reel people in. And then people started coming to the table and get their blood pressure drawn. And I didn't realize that the PR person from American Heart Association was there and said, Alice, you kind of have a way with words. Would you mind going on the radio, on KJLH radio, and talking about how to be heart healthy during the holidays? I said, sure, I'll do it. Next thing you know, can you talk about the signs and symptoms of a stroke and what people should do? Sure, I'll do it. Next thing I know, I developed relationships with the radio producers, and they're bringing me on to talk about other health issues as I continue to do other things for American Heart. But at this time, I didn't really think that I was doing media. I was just teaching. I'm as a nurse. And so I kind of fell into this and basically was continuing to be a health advocate, just using a different platform, a wider platform. And that radio led into writing blogs, and then it led into doing television. So, and that's where things got a lot more trickier, and we'll get into that. And then just as this past year, I joined nurse.org as their chief nursing officer to help with some of the campaigns and education programs that we're putting out, because not only are we wanting to educate the nursing community, but we're also wanting that information to spill over into other people who can influence our education systems, our practice, and then the people that we serve. It's important for them to know who we are. So as of late, we know that every time you turn on the television, there's something being said about COVID. I have been, even before COVID came to the United States, I have been on television talking about this almost every day when it first started. Now I think I do it about 5 or 6 times a week at a minimum. It was so important for me as a nurse to share my expertise. Now some people will say, oh well, and I've heard this, oh well, you're not a doctor. No, but I'm a nurse and I take care of patients. And as a qualifier, many people ask me, well, what qualifies you to be on television talking about these things? For one, I'm a nurse. I'm a licensed healthcare professional, advanced practice nurse at that. And as well, I was the first nurse in San Diego who would receive a SARS patient. I don't know if you guys remember SARS back in the day. I don't know how I ended up with the only ICU bed patient. I had the open ICU bed. And they said, Alice, somebody's coming. We have SARS. And so I just remember this, everyone swarming around us. I put on this white spacesuit type of thing. And then it's like, okay. So I just had that. It's a lived experience. And then as well as nurses, we moonlight often. And I've moonlighted at the juvenile correction system in San Diego. We had a child who was picked up at the border who had symptoms of TB entering into the juvenile hall building, very old building. The vents were all connected. I'm on the phone at 2 in the morning with the CDC and the NIH and everybody. My boss is coming in and we're figuring this out. So I know pandemic. I know how to prevent, I know what it's like to be in a situation where there's a potentially contagious disease that needs to be contained. So that's what qualified me. And I think once I explained that to some journalists, they got the picture, but they don't know these things about nursing. So that's one of the barriers and why we don't see as many nurses on TV. But I'd like to ask, how many nurses do you see on TV? Anyone think of a name? So, and listen, there's so many nurses out there. We should be leading the charge. And when it comes to issues about maybe the pandemic, policy, research, there's so many different things that nurses are very qualified to talk about. It's just we don't necessarily know the tools or know journalism or the media. It's like going to a unit. I'm an IC nurse. You send me to oncology. I know the fundamentals of nursing, but I don't know exactly where everything is. There's certain chemo drugs I don't know. So we just need to learn the lay of the land. So I'm going to show you a real just kind of spotlight of some things that I've done and talked about. And this is pre-pandemic, trying to give us some COVID-free stuff here. It's everywhere.
Nurse Alice Benjamin is joining us. She's also known as America's favorite nurse.
There's a lot of research out there that shows that in 28 days you can break a habit or change your mindset. So if you make one small change over 28 days, it will become a part of your permanent healthy lifestyle. Our stethoscope, which I kind of have here, it's really important that we as healthcare professionals take the time to decontaminate these things because these should be considered an extension of our hands. We have to be careful because this will open the floodgates and open Pandora's box to designer babies. I mean, the next thing you know with this technology is especially in the wrong scientist's hands, we'll be ordering our babies, right? Just like we go to the drive-thru and order what we want. He should be exercising, and it's sad to see that he's given up on exercise, because I bet you exercise and a little bit change in his diet would make a big difference from him. He'd probably sleep a lot better, he'd lose some weight. What I really want viewers to know is don't throw your coffee cup away just yet, because although there's some concern about acrylamide, which is the compound of concern, coffee itself does not cause the cancer. When it comes to pancreatic cancer, it's the fourth leading cause of cancer death. And stage 4 is basically the most advanced stage of cancer. Basically, the stages go from 0 to 4. And when we progress higher in the number, that usually means that it's spread to the lymph nodes, it's spread into the bloodstream, and it's spread and invaded other organs of the body. So one thing is, never put your whole turkey back in the refrigerator. You'll want to cut it up in small pieces and store it in shallow, airtight containers. And if you do it that way, you can enjoy your turkey in the refrigerator for up to 3 to 4 days. Not only is the beet good at helping to bring your blood pressure down, this is nature's Viagra. Juicing is very important. You need about 5 to 10 servings of fruits and vegetables every day, and we're not really taking that in. Who's really eating all that? I think a lot of the public generally doesn't know what nurses do. I mean, we do more than blood pressures and give shots. We actually touch people's lives.
So that's just kind of a little sample plate of some of the things that I've talked about on television. But many of the things that I've talked about have been based on new research, new evidence. Some of the things I've talked about include eating healthy, how to better take care of yourself in a fun way, because it's still television. Going to be engaging and entertaining and still. Talking about cancer. Now that you didn't see here, I talked about the importance of cancer screening and which cancers you can screen for, like pancreatic cancer. There's really no screening test, but these are the things that you look for. So many things that we would do as nurses already. Educating the public on various issues. I think the Thanksgiving piece that I did, I was basically trying to teach people not to eat your leftovers like 2 weeks later so you don't get salmonella, come in the hospital with food poisoning. But these are the things that people are going to tune into the television already. So we can either get on that train or we can just miss the boat completely, because we can create all of the health events that we want people to come, but sometimes you have to meet the client, the patient where they are. And that's on their living room set, now on their devices. And bite-sized pieces of information. And, again, this was pre-COVID. A lot of the things that I've talked about with COVID now have been, I've been doing a lot of education with that. So let me ask, I think this is my next slide. What's one of the #1 questions people have asked about the vaccine? Those who have been hesitant. What are some of the questions that have led to hesitancy? Let's just ask you. Okay, which one should I get? How did it develop so fast? Yeah. So those are the questions that I tackle. Maybe it wasn't my next slide. But those are some of the questions that I tackle. And this is why I've kind of adopted this now that I've entered into the specialty of media, because it's very much indeed like a specialty. As a mother-baby nurse, I wouldn't necessarily go to the stroke unit and just, although I know some fundamentals, there's definitely some things I should know about the lay of the land, the patient population, the medications, the lab values, anything's unique to that specialty. And so this actually is an article that I wrote in conjunction for the American Nurses Association, and it talks about the nurses' growing role in media. It's not necessarily that we want the spotlight, but as the most trusted healthcare profession per the Gallup polls, as the largest segment of the healthcare workforce, it's our duty. We don't just go to work, and you're not just a nurse 8 hours or 12 hours of the day. You're a licensed healthcare professional. You carry your license. When you sleep, you're a nurse. When you wake up, you're a nurse. When you're at Disneyland, you're a nurse. I mean, you're just a nurse. You're not just a nurse, but you're a nurse all the time. So, and many of us became a nurse because we enjoy serving others, helping to take care of others, especially those who can't take care of themselves. And one of the ways we can do that is through educating. So I wrote this article for the American Nurses Association, talking about how we can use our clinical expertise to communicate with the community and populations that we serve. Because the end goal, I've always heard it said, we want to work ourselves out of a job, right? We want people to take care of themselves, so much so that they don't need to come into the hospital for acute care. We want to swing the pendulum to focus on prevention, wellness and prevention. So when I was talking about the vaccine question, this is something that we actually shared on NBC, because there were so many people saying the vaccine happened way too quickly. Why is this so? I don't want to take it because they probably made errors and all of these things. So a simple slide, something like this, how the vaccine was developed so quickly. Should I close that?
Yeah, go ahead.
But I mean, some quick bullet points. I mean, it takes less than a minute to go over this entire slide with people to help ease their worries and concerns about the vaccine. So, I'm not sure if everyone in here knows how the vaccine developed so quickly, but we had, coronavirus as a family. We had tons of information we were already building on. There's so much money that was invested into this vaccine. So we had people working around the clock, 24/7. What happens when you have unlimited resources? You can get stuff done. The part of why vaccines take so long to develop, they spend a good portion of their time looking to recruit volunteers for their studies. Here, you didn't have to worry about that. You had people raising their hands, jumping on board, wanting to get the vaccine. And manufacturing happened at the same time as the safety study. So that was a little risque, because had they mass manufactured something that was unsafe, they would have had to throw it away. But that wasn't the case. So I share this. So this is the timeline. So these two slides, we got thousands and thousands of responses on television about the same thank you, we didn't know. And if I have just one person who listens to the education that I share on television, I feel good. And even if they still decide they don't want the vaccine, at least now they have the information to maybe later, if they decide to or not decide to, but at least they understand why the vaccines seem to have appeared so quickly. It's because if you look at the top slide, the manufacturing development happened at the same time as testing and approval. And again, that's the research volunteers, their time was truncated because we had people volunteering. So I asked earlier if you saw many nurses on television, and I think many of us, we don't see as many. We see a lot of physicians. Well, as the largest part of the healthcare workforce, again, voted the most ethical and trusted profession, we should be. And one of the reasons, a reason why we should be in the media is because the perception, lots of things are voted on, passed, accepted, adopted as kind of Bible, if you will, because they saw it on television, so it must be true. Well, if nurses aren't speaking, or if nurses aren't showcasing the work that we're doing, I know there are tons of professors that have, there's lots of nurse researchers out there. There's so much research that needs to be shared. We need to combat some of the negative images that Hollywood has unfortunately portrayed for nurses, very unfavorable. You guys have seen the television shows. But I mean, these are the images of nurses influence public opinion. So it's very important that we share these things, our achievements, important issues, quality care, safe staffing. A lot has been, we're discussing right now, the real nursing shortage. And nurses, we can influence the current media and the perception by being the change that we want to see. So here are just, again, some examples. This top slide on KTLA, talking about workforce violence, abuse against nurses. We don't talk about it enough. The public doesn't always realize how much it happens. Talking about the new warnings being added to the Johnson & Johnson vaccine, keeping people abreast on what to look out for should they get the Johnson & Johnson vaccine. I was last month on Good Morning America talking about fibroids. Fibroids is pretty prevalent, but it's not talked about a lot. There's not a lot of research happening around fibroids, and there's an awareness that needs to be shared. And then I had a chance to talk to good old Dr. Fauci. So obviously we know who he is, and he's been talking. We saw him on the media a lot, but we didn't really see him talking with nurses. And so as nurses, we've had a lot of questions for Dr. Fauci, which he kindly came onto our show and he answered for us. Now, as much as I talk about research on television, I got to bring research back here to media. So just so you know, media has been studied in the nursing profession. So the original study is called the Woodruff study, was published in 1998 by Sigma Theta Tau. And it was basically spearheaded by the founder of USA Today, who was Nancy Woodhull. She had developed cancer and was in the hospital and was so impressed by the care that she'd received by nurses. She looked to her own publication and said, hey, are we using nurses enough as health experts? We need to use them more often. Let's do a study and look to see how often nurses are used as experts and resources for media. So I'm just going to fast forward this a little bit. It was 4%. 4% of all of their medical experts and things like that were nurses, images included. So what happened is 20 years later, Dr. Diana J. Mason, who was the principal investigator at George Washington University, they did a Woodhull study revisited. So mind you, some of the publications that were then aren't necessarily in existence now, but they tried their best to replicate it as much as possible while adding some other components. And I'll say, what do you think the results were? If we were 4% previously, what do you think we were now with nurses being represented in media? Less? Price is right. It's like bidding a number. What's your number? 2. Okay. 2. Go get a 1. Anyone? So before I get there, again, there are 3 nurses to every 1 doctor. So that's kind of teeing you up for this answer. We should see a higher number, right? 2%. 2%. Yes, much lower, right? You would think that it would be more, but it's not. It is that. And let me just go. Oh, So why is that? We know that the nursing profession is predominantly women, right? About 90%, 85, 90% women. Well, if you look just in the newsroom alone, there's only 24% of women in the newsroom. So you have less women with the ability to green light and have nurses come in, which are predominantly women. I'm not saying, but I'm kind of saying that it's a gender thing. That's some of a piece of it. But also we look at women very just underrepresented in media, period, without even consideration for nursing. So we have an uphill battle. The kinds of stories that nurses are mentioned in. Well, we've seen nurses on TV a lot lately, right? What are we talking about? When you see nurses on TV now, what are we talking about? COVID, and what about COVID?
Stressing us out.
Stressing us out. We're leaving the workforce. This is too hard. No PPE. Labor issues, right? Or sometimes you'll see, like Nurse Lovell, the violence against nurses. So labor and profession issues. So where are we when it comes to quality education, research, and policy? We're doing that. We participate in that. We're very knowledgeable to talk about that, but yet we're not the ones who are sharing these things, whether it's television, whether it's radio, whether it's in print, magazine. We're not seen being the voices of these stories, and we should be. Now, there are definitely some barriers to this. So before you decide, why do you think we don't have as many nurses doing that type of work?
Well, we don't really teach them nursing in school, so a lot of nurses are not thinking about it.
Right. Okay, so they're not thinking about that. Okay, that's good. That's one. What's another?
Maybe burned out from working.
Too busy and actually taking care of patients and burned out. Yeah, that could be another thing.
We are just not on journalists' radar, full stop. Even if a nurse is like the national leader in a specific topic, they'll go to the MD or another profession in that topic.
Yes, that's another reason as well. So those are all good reasons. Journalists don't fully understand the role of a nurse. They don't know exactly what we do. They have an idea, but they don't know exactly how well versed, how knowledgeable, and how skilled we are to talk about these things. Hence the example that I had with one journalist who challenged me as to kind of why me? And I gave him those stories, and I'm an advanced practice nurse for 23 years. And those examples, and he's like, oh, I didn't know nurses, do that kind of thing. And I didn't know nurses were even interested in doing that as well. Journalists also don't know how to find us. And they're on very quick schedules. All I have a story that I need is let me use this example. So yesterday for the 11 o'clock news, we had poor air quality in Los Angeles. A reporter calls me at, I think, 7:45. Nurse Alice, can you give us some sound bites on some things of, what we need to know about air quality? What are some tips? So who's at high risk for problems and what we can do to prevent issues? Okay, sure, when? When do you talk? Can you talk in 15 minutes? Literally, my hair is wrapped up, I'm in pajamas, and it's just like, it's very rough. I did it. I kept my pajama pants on, but I put a nice top on. And so those are some of the reasons why we're not in stories. Now barriers that keep us from journalists. What do you think those stories are? I think nursing school we're not primed for that in nursing school. What else?
There's one in the chat section as well. Jayla,
Am I missing some chat questions?
I think Priscilla Hall contributed a barrier for nurses in the chat box next.
Okay, so should I just hit the chat, open the chat here?
I can read it out.
Okay.
A lot of nurses have internalized the healthcare hierarchy and feel that MDs have something more important to say. So they let doctors do all the talking and they don't seek the limelight.
That is true. So there was, it was February, or Heart Month, right? So here I am, cardiac clinical nurse specialist. I'm working at a level one trauma center in Los Angeles. We do the most heart transplants in the world. I'm the person that's orienting and training the nurses how to the VAD, the transplants, like, I know heart. And there was a story on Fox about heart health, and I was asked to do it, and said, Rochelle, thank you so much, but we're gonna get back in touch with you. We found someone else who's gonna do it. Well, who's gonna do it? Dr. Manning. Dr. Manning's the OBGYN. I don't know what that's about, but and then I listened, I watched and I listened, and I thought to myself,
He was the wrong person.
he was the wrong person. He was very, and you only have a couple minutes, so you can't go too deep into the weed of things, but I just knew that I was like, there's so many things that I would have said or wanted to say, and he kept it very surface, but that's the physician versus nurses thing, and it shouldn't be that way. It's whoever is the most qualified, whoever has the most experience, most passionate, and who's also well versed to speak, because some people, they're kind of dry when they talk, and that's the other part that we don't necessarily consider, but you have to be engaging to your audience. Hence my Viagra statement to the beat story, right? If anything, you're going to remember that, like, oh, I better eat my beets, or whatever the case may be, right? Right. Beet juice is actually very good, just so you know. But there's some barriers. So, in the hospitals, when journalists are looking for nurses, they will typically pivot to the chief nursing officer or director, not always the bedside nurse to tell the story, even if it's a clinical issue that the bedside nurse is well versed on. And I think some of that is out of fear, because we are not necessarily media trained. And God allows us, we get really passionate, but sometimes the wrong words can come out your mouth. And they can be misconstrued. And those sound like they take that 5 seconds or something, and then it's whoop, and taken all out of context. So there's some barriers there. So there's some remedies to that. There's definitely some things that we can do. Also what they added to this study was they looked at social media. Now, I know it's Twitter. Instagram was not a part of this study, but Instagram was just budding, I think, around that time. And honestly, Twitter is kind of the social media outlet that most news outlets follow, because you can that's really more newsy stuff. Social media, the Instagram is more pictures and what you eat today type of stuff. This is more of the newsy things, although that's pivoting a little bit. But what the study found was that nursing schools, while they have tons of research, tons of great information and programs and things that they're doing, when they share on social media, they share the content in a way, but using hashtags that are inward facing, where it's almost like, you don't go to Emory, you're not a nurse, this is not for you. This is only for us. So we have to learn how to use hashtags properly. Now, hashtags are a way to kind of quickly catalog something. Hashtag the real nursing shortage. So if I put hashtag the real nursing shortage on Twitter, all of the posts that have that will come up. So that's a quick way to find things. So we have to be more clever about how we apply hashtags when we're sharing our information and our research. And it's also interesting to know that only 1% of the followers for the schools were media outlets. Now, if you are a school that's producing tons of research and you want to share your information, you need to follow these news outlets. You need to like and engage. It's social media. If you don't socialize, they're not going to follow you. That's just the game it is. And some, oh, well, they should follow us because we are so-and-so. Well, no, that's not how that works. They're looking for active activity. Excuse me. They're looking for activity on social media. They're looking for people sharing message constantly, like in innovative ways, using creative hashtags so the journalists can see it, the public can see it, the respective populations can see it. So, it's going to be real important. And I'll say this University of Michigan and University of and Stanford University. I actually get emails from their School of Medicine and their PR department about their new studies, because I did Stanford had we called it the brain stethoscope. They're able to take the silent seizures and with electrodes on, they're able, and some sonic device able to create sound for silent seizures. And they nicknamed it the brain stethoscope. I did a story on that, and it was catchy, brain stethoscope, like wildfire. Everyone was talking about it. And so they saw that, oh, this is a way to get our research out there. So they partnered with, well, not necessarily partnered, but informally, now they send me stuff all the time, stuff I don't even want, but they send me stuff, a lot of stuff. But I mean, good stuff. It's just too much stuff. But you have to find who those outlets are, who those influencers are, who those journalists are that's going to champion your story and share that information. So you have tons of opportunities. Nurses, we can correct the inaccuracies and speculations between the science and the journalists. So sometimes, I don't know if you guys saw the Nicki Minaj tweet
Oh my God.
about her cousin's friend
Yes.
and the so-called side effects of the vaccine. We got to jump in and correct stuff like that, okay? Possible educational moment for something else, right? Maybe sexual health, something around there. But this is not a side effect of the COVID vaccine. It possibly is, but and sharing important messages. We also can tell stories that are accurate, important, and relevant to the audience. Sometimes journalists will approach me about a story, and I kind of look at them like, "You want to talk about that? Why don't we?" It's really important. What we're seeing in the emergency room, what we're seeing in the ICUs are this. Oh, well, okay. They don't know. They're not in the ICU. They're not in the ER. They don't know what the stats are, the recent stats are for a particular disease process, or if there's been a recall on a certain device, or you're having issues with certain things. So you can help them. Also collaborating with them. They don't have the knowledge or expertise that we do as licensed health professionals. They definitely don't have the time to prepare. So the story about poor air quality, he called me like in 15 minutes. That 15 minutes, I really was just doing my hair because I already knew the points. So a journalist would have had to spend hours researching this or finding this or looking for another expert. And I was ready to go. So that's another thing that makes it easy for me to work with journalists, because now I can't comment on everything, and some things I will decline to talking about, especially if it's out of my wheelhouse, but I'm prepared and I'm ready to go. I roll with those punches and I help them. And then also, as nurses, we can help scrutinize the data. A journalist will say, oh, there's a study that showed 90% of these participants, ended up with bladder cancer. Well, this is a study of 8 people. I don't think you want to generalize this to the entire public. So helping them scrutinize the data. And also insert other things that might be helpful or beneficial to know about the cost or pros versus cons of a particular procedure. So there are different types of health journalism. Now, I don't call myself a journalist. I'm an advanced practice nurse. I'm a health expert, but I had to learn a little bit about the lay of the land. So what actually helped me was I actually took some courses out of the journalism program at UCLA. So I'm not trying to add to nursing school. Don't get me to say that. But I think as we develop our nurse leaders, perhaps would be a great elective for some, and doing it in conjunction with public health, School of Medicine. I've heard of some schools, physicians having residencies, doing like media journalism residencies. I've not seen something like that for nurses, at least not, and I know there's a lot for pre-licensure undergrad, but even in your master's program or in your DNP program, I believe there should be opportunities for us, because you'll learn all these other things about media consideration. There's research, you have a great story, you have the clinical experience. There's stories you need to tell, but there are also little idiosyncrasies that you need to consider. Well, the producer wants the story that has all the ratings. They want to be first to tell the story. The journalist wants to tell a compelling story. The scientist is all about the data points. It's all about the research and the numbers. We as health experts, how does it impact your health? What does it mean for the patient? And then the public just wants to know, what does this mean for me? What am I going to do with this? So you're going to have to take all of these things into consideration when you're crafting your story. So if you do television or radio, you have a short amount of time. If you do print, you have a little more time to write things out. But you have to consider these things as you're packaging your story. But definitely you can use media to advocate, educate our patients and families and be on the bedside. We can tell the untold stories that need to be told. And also, I love working with physicians, but physicians can't tell nursing stories. They can't tell things from the nurse perspective. They can't tell you what it's like per se. And I know that some physicians are, intensive, they're in the hospital for shifts, but not all physicians are in the hospital for the entire shift. They come to the patients and they leave. And that's not enough for them, but there are just certain stories that we, by being with patients for such a prolonged period of time, have the ability to tell. We have the ability to lead national conversations, and we can change lives and influence not only public opinion on health matters, but legislation. We need to be able to tell the stories of what really happens in the hospital, what really happens at the bedside, what's really needed. Where do those dollars really need to go to impact our healthcare system to improve it? So, I mean, just some examples of some topics that I've talked about in the past. There are different medical advancements, the Affordable Care Act, opioid epidemic, staffing ratios, violence in the workplace, different consumer health issues, and definitely breaking news. And with nurse.org, I've been working with them. We have what's called the hashtag the real nursing shortage. Now, while we know that there has always been a slow brewing nursing shortage because of recent issues of the pandemic, I think it's compounded and it's accelerated it. For a variety of reasons, nurses are afraid of COVID, afraid of spreading it to their family because of some of the mandated vaccine things that are coming down the pipeline, a variety of reasons, overstaffed, underpaid, overworked, you know, there's a whole gamut. But so with working with nurse.org, we were talking about some of those other issues that we don't talk about as much. We talk about people aging out and retiring. We talk about the shortage of nursing programs and educators, and also the compensation for educators, because you guys are responsible for teaching the next generation. We need to make, just as much as ICU is a specialty, our educators need to be just as compensated and prepared to teach. So we talk about a whole variety of things, and we have a great toolkit on the website, but this is what we've been collecting data. Nurses have been doing a survey, and we're actually compiling this data. And just to, so you know, and I'll say this, there is mainstream media and then there's social media, two totally different things. But they both can be used in a very, when used responsibly, in a very effective way of getting important information out. And so just to real quick to share, the Real Nursing campaign has captured the attention of several nurses around the nation. There's a particular hospital, their OR department, their OR nurses were inspired by the toolkit, crafted a letter, and took the letter to their managers asking for certain resources so that they could feel safe and so they wouldn't leave. And they want, you know, they enjoy what they do, but they don't want to leave, but they're considering it if things don't change. They wrote a letter, had a conversation with their managers. Managers agreed. They're like, you know what, you're right, you deserve it. They took that to the director level, and now these changes are going to be implemented. So it's helping to give nurses the voice and the verbiage that they need instead of just complaining. There's things, when said the right way, can get you the things that you want. But when you're just, like my son, when he's just complaining about something, I'm just like, okay, Kyrie, okay. But when he says it to me in a calm manner with very, you know, in a calm manner where there's like actionable items and it's very clear, it's based on, you know, certain concrete objective data, I'm like, okay, that makes sense. So it seems like we're helping a lot of nurses, and it's captured also the attention of the California BRN executive director, who the California BRN has actually asked us for our data, the data of our poll, so they can share that at their BRN meeting, because they're going to be making some changes and recommendations and want to hear the voice of the nurses who don't often attend their Zoom meetings. So how do we get more nurses to be in media to do these type of things? Well, some of that would include having media training for nurses in leadership programs or electives in schools. If you're not in a program like that, you can take a public speaking course, a writing course, journalism course, anything to sharpen your communication skills. And it helps to teach you the media and journalism landscape. Because people will say, well, I have this story, I have this data, but who do I talk to? Who do I send it to? Who do you pitch your story to? Those are the things that we need to know. We also need to create and update organization policy that empowers, educates, and encourages nurses to participate. So again, I think many hospitals, I'll use hospitals as an example, are fearful of what their staff might say, might or might not say. They might open a whole nother can of worms on, like, we're not even talking about that issue, we're talking about this issue, but now they've misspoken. So I think media training can be very powerful. Also introducing yourself to your hospital or organization PR media team, because many people don't know that nurses want to do this or have an interest in doing it. And maybe you don't want to talk about a lot of things, but you say, you know what, I'm the lactation specialist, anything around birthing, breastfeeding, things like that, I'm your person. You know, let them know what your interests are. And then also nursing schools need to send, organizations as well, but nursing schools need to send out press releases for the research and the data that you use. Medical schools spend lots of money on this. They spend lots of money on this. I get what's called, I'm a part of a few, but it's called Newswise, and I get journalism privileges, meaning I get embargoed content. So let's say Stanford has a new device that they're going to be talking about, a new study that they're releasing. I'll get that study about 2 weeks before the general public, get a chance to digest it. They'll list some of the researchers that are on there if I want to interview them or ask a couple of questions. So I can package up my story. So on that embargo date, so let's say it's Saturday at noon, you ever wonder what everybody drops the same story at the same time on television? Because that's the embargo date. So on Saturday at noon, I can talk about their new study. And it's all packaged out. I've had plenty of time to review it, talk to the researchers, get whatever pictures, images I need. And so I get that. So nursing schools should be a part of that. Share that with, you should be sharing those press releases out and even ahead of time so journalists can sit with that embargoed content. Create your own content. You know, and we can work with nurses at all levels. Nursing students, nursing seniors, maybe, you know, new grads. I mean, we're nurses. There's something that all of us can contribute when it comes to educating the public. And also collaborate with your media affiliated associations. There's a National Black Journalists Association, Association of Healthcare Journalists. So many different associations you can just affiliate yourself with. And oftentimes they have seminars or webinars that you can attend or conferences, which I've gone to a few of them. And then pitch the topic you'd like to discuss. Sometimes stories aren't told and we want to hear them, but we need the storytellers. We need the people who are going to be the voice for that. And so as a nurse, I'm a voice for my patients. I feel like it's very important to talk about important issues. And sometimes that includes sharing some of my own personal journeys. So just as much as we are nurses, we're also consumers of health. I was very public to talk about even my own initial hesitancy about the vaccine and what and when I changed my mind. Because, you know, we can't paint everything like it's perfect. I'm not perfect. I had hesitancy, but I looked at the research. I asked my questions. I became more comfortable. I looked at the infection rates, the death rates, and I realized that I wanted to protect myself and my family. So I think when I tell that story, very, you know, down to earth, because I'm relating to people, because I'm a consumer of health as well. I have issues, concerns about medical things, and you know, I think when we can be honest with those things and sharing the data, that's when people are more apt to listen and lean into our stories. Any questions?
Could you share a little bit about the difference between putting something on a newswire and having many journalists read it and look at it and then prepare for the embargo lift date versus thinking about an exclusive, saying like, this is the journalist or this is the outlet that I want to have my work, and like, you know, what nurses should be aware of and how to maybe think about pushing out that next new research that they have in their publication pipeline?
Okay, oh, that's a load of questions. Okay, so I'm gonna take the first part is the newswire. So it was
Like difference between the newswire versus the exclusive.
okay. So with the newswire, so what I generally get is an email that has tons of different stories, research from hospitals, sometimes worldwide, Italy, France, everywhere, everyone that has, and they will have different dates, embargo dates. And they also come with the researchers' contact information. Sometimes there's video, sometimes there's picture. And I have all of these things that I'll read the press release. Then I have the opportunity to read the actual full research. And then I will decide how I can pitch this story. And then also keep in mind, so currently I'm an NBC Los Angeles contributor, but before that, when I was more of a freelance and I would do a bunch of different outlets, I thought to myself, whose audience is this? Which would be the best outlet to pitch this to? And what would be the best spin for this? So I'm gonna take something like, this is very, not as a serious topic, but there's, I think it was UCLA came out with the beauty vaccine. Did you guys hear, have you ever, it's really an acne vaccine, but the buzzword, the beauty vaccine, it just really makes it very, that's some sex appeal to it, you know, makes it kind of attractive to listen to. So, so I thought, okay, this is an acne vaccine. It was really targeting adolescents. And so with that story, I thought about who the population is, where is that audience, and how I can best pitch and craft this. And I read the research study, and if there's not, I don't necessarily always contact the investigators. If there's something in the study I don't fully understand, I'll do that. But then I pitched that to a few different outlets. So for nursing schools, I would encourage the nursing schools to get a hold of those type of newswires. So there's Newswise, there's Eureka. Those are the two that are most common. There's some other ones out there, but generally, for the most part, it's a free service. Like if you just wanted to get free service, but there are certain components, unless you have to validate that you're actually a journalist or a story or someone who can tell a story, to get some of the embargoed content, but you can still get a list of everybody's what they're putting out. So there's that. And then the other one, exclusive.
Mhm.
So an exclusive is that you have your study and you want to share it with one particular outlet, like Good Morning America is good at, or the Today Show. Now those are kind of harder to do. And you can share with them, and they do, sorry, it's sneezing water. They do like to be first. But once you have an exclusive story, they just want to be first to tell it, and then you can share it with someone else. And with important studies, you want it to get out to as many people as possible. And sometimes when you're telling your story, you may have to pivot, like you have individualized patient education. I might do my teaching for someone who, let's say, high blood pressure, and I'm doing education around nutrition and eating. So it might look different for someone who is African American who indulges in soul food versus someone who is Latino and eats Hispanic food. You know how you individualize it based on their diet and their foods and their preferences. So you might have a particular study or a specific medicine or device, and you need to cater the message to what's most important or relevant to that population. There are stories that I've shared with BlackDoctor.org and Black Enterprise that are more geared towards African American population, although it's a condition that impacts many. So when you're telling an inclusive story, make sure you'll want to pick an outlet that I think is a larger outlet, I would imagine, if you want to be exclusive. And generally, you can tell that story, and you'd have to decide with that outlet how long they want to be exclusive, how long until you can tell that story to someone else. Okay.
Thank you so much. We also have questions in the Q&A section there on the left. And of course, anyone in the room wants to ask questions as well. So the little number 2 there, if you click on it, you should see a couple of folks.
Okay. Okay. How have you handled negative news about your missteps you have made while in the public eye? How do you handle negative news about your missteps? Not quite sure I understand the question.
Like if someone says something negative about you as Nurse Alice, like let's say you say something in the media and it's not well received and you get all this negative feedback.
Well, I have received email, well, not me directly, because I'm just on social media and stuff. What does she know? She's not a doctor. I just kind of overlook some of those type of things. As long as I know that the information I delivered is accurate, then it's accurate, well-intended, and it wasn't said maliciously. Because you have to be very careful with how you say things these days. So careful. And sometimes I can even slow down your messaging because you're like, hold on, I want to make sure I don't offend anyone, and how do I say this appropriately? But I think probably, I mean, we call them trolls on social media. You know, there's always going to be somebody out there, but I think I've gotten the message that what does she know? She's not a nurse. Okay. Have you been able to combat the lies and misinformation presenting at this stage of the pandemic? Well, even the Surgeon General and the president this is a war on misinformation.
Yeah.
There's so much misinformation out there. And I think the best way to combat that, rather than arguing with the person and their misinformation, is the good thing about social media is you can report it. I know that you can report it on social media. And then as well, it's just to flood the internet, flood the airways, flood the publications with accurate information, rather than spending your time and energy arguing with someone who's never gonna, you know, see otherwise. Instead of arguing with that person, take the time to educate the masses on what the correct information is. That's been my approach with it, and that's how we handle it at NBC. Yes.
I was gonna ask, how do you control, or when you're talking about a topic that's controversial, that has two sides, for instance, the COVID vaccine,
Mhm.
you have people pro and against it. How do you deliver the content based on what's being recommended by professional organizations, or do you insert your subjective thoughts about it? Like, how do you balance that, or how do you
Oh,
decide?
that's a good question. So a little bit of both, but when I share, like for example, flu vaccines. Now, you know, everyone was so worried about COVID. Now, like, no, flu vaccine. What do you mean, another vaccine? You know, I just asked Nurse House, do you feel like it's really that the flu vaccine even matters right now when we're dealing with COVID? Well, yes, I do believe it's still important, because the COVID vaccine cannot protect you from getting the flu. So that's how I insert when I say my opinion, it's my clinical, my clinical recommendations would be. And then I'm very also careful saying, you know, well, I'm not, you know, I will say what, so in that case, I said, you know what, yes, I do believe the COVID vaccine is important. However, as we enter into flu season, we didn't have much. I explained what happened last year, because in addition to just saying you should get the flu vaccine, I need to be objective. We didn't see much of a flu vaccine last year. Why? Many of us were all at home. Kids were social distance. Our kids were learning from home. Many places, employers were working remotely, and all of the things that may contribute, the mask and that. Now that we are open, now that the economy is open, kids are back in school, we're back at work, the probability of getting the flu is more likely this year. Historically, our flu rates have been yada, yada, yada. So yes, I think we should strongly consider also getting the flu shot this year. So I have to frame it that way. So it's not just, well, yeah, so they understand the why of why I'm recommending that. Yes, ma'am.
When you were freelancing, how did you get yourself out there? Did you call around to different media outlets and ask for them to interview you?
So I told the story about, I started with American Heart Association and the radio, and then people started asking me if I would like comment, and then I started writing blogs, and then it spilled over to TV, and I think that's because they just found me.
Oh.
They didn't know that so many journalists don't ask nurses to do this because they don't think that they're nurses that are interested. So when they see someone who's doing it already, they're like, oh, she'll do it, let me ask her. So I think that, you know, that's one of the things, and I was just very consistent about sharing information. So I was already sharing health information. So to them, okay, well, she's already talking about this topic. She's, you know, she's knowledgeable about it. We've seen her already do something else. It's like having a virtual resume. They've already seen me on television. So that part. And then I also attended the Association of Healthcare Journalists Conference and some other journalist conferences that I kind of saw in Los Angeles and around the National Black Journalists Association. I attended their conference. So I put myself in the room with the people who needed someone. And when it came to the topic of health, I just, you know, I would comment, I would engage, and I made myself available. It's like applying for, I didn't necessarily apply for a job, but I put myself in the space with potential employers to know that, hey, I'm here, this is what I do, I'm interested. And they could see that I was also trying to fine tune my skills to better understand the work that they do. There are services that they'll solicit and say, we can get you on television if you pay us X amount of dollars. And I always caution people against those, because they'll take your money and not necessarily get you the opportunity you're looking for. So just be careful with that. Any other? Yeah.
So as somebody who's working full-time, not necessarily doing this, how much time do you say, or what suggestions would you give to be able to promote yourself? Because it's not really being that you do full-time, but you want to get your work out there.
So I think nowadays everyone's on social media. So if you're sharing information on social media, that's a great way to do that. So you be out there engaging the conversations. Sometimes there's Twitter chats, or so engaging and using the hashtag so journalists can find you. If they're looking for something with nursing shortage, they're going to put in hashtag nursing shortage and look who's commenting. Oh, there's a nurse. Maybe that person will talk to me. And I think social media, you can have a website and create your own content, like on YouTube. Do a short video and post it on YouTube. The Google search is very powerful when journalists are looking for people to do that, having those things. Now, if you work full time, how do you do this? It's challenging, but it can be done. So I already volunteered with American Heart Associated ARP, so I was already doing that community work. So that community work kind of helped me to find this pathway. But if you're just getting started, I would say be very active on social media. And then also, if there's ever an opportunity to meet with a journalist or be in the same space with them, let them know that you're available. Contact your local news station and say, introduce yourself and say, if you guys ever need an expert to talk about X, Y, and Z, I'm available.
You can also let J-Mike and me know if you're interested in being like a student contributor or a faculty contributor for anyone in the room. And when we have folks who reach out to us from the media saying we need an expert in XYZ, we can have your name on file and your contact info and put you in touch with journalists who come through.
So, any other? Yes, ma'am.
Well, first of all, thank you so much for coming. This has been amazing.
Yeah.
How do you have any advice for, I guess, nurses who have just like imposter syndrome, just of like getting out there and speaking out and just being confident in our role and what we want to educate and stuff like that. Like I've been wanting to start a podcast just for like tips for nursing students and stuff like that for the longest. But I always, when I get to it, I'm like, oh my gosh, I can't do this.
Well, it's like being a new grad. So initially, you're gonna, it's not gonna go smoothly as you like, but the more you do it, the better you'll get at it. And I just say, don't let perfection paralyze you. Just getting started is the hardest part. But once you've gotten started, everything will be easy from there. It's like writing a paper. Have you ever, that it's so hard. You ever notice? It's real easy to edit a paper, real easy. But the starting it, you're like, oh my gosh, you're working on the first paragraph forever. But just get started. Don't let perfection paralyze you. Just get it done. And imposter syndrome, even myself sometimes still. I'm asked, to come talk about a particular topic. And I'm like, whoa, hold on. Let me look. Any new research? Try to benchmark practice. And so that's something that I'm constantly doing. I've never gone on air, I think, with the exception of the air control thing, because I knew that because that's a story that happens every year. Some of these things are seasonal. Save your notes. I saved my notes on fires, smoke quality, so I had notes to build off of. But, so some of these things are seasonal, and every year you'll get better at it. So I'll take the air quality piece. The last 5 years, there's a fire season in California. Winter, spring, fall, fire, winter. We have a fire season. So we always have this issue with air quality. So I've saved notes, and every year I've built upon it, finessed, fine-tuned it. So that's something that's helped me there. But to get back to your point, I say just get started. Just get started.
All right. And co-director of innovation. Sorry for one second, folks. Are you okay? Okay. And she is the co-director of innovation and technology and the Urban Health Initiative at Amore. She's an expert in technology development and the founder of the Take to Heart initiative. She developed the Transformative Technology Evaluation Assessment Model, 2-Team, and the 2-Team to Go model, which consists of the development of smartphone apps, application data aggregators, and websites to bridge the gaps in clinical practice, education and training, research, and health policy. So she's able to drive meaningful outcomes using evidence-based real-time data that are uploaded to these data aggregators, connected to smartphone apps, and available on websites. She leads a team of collaborators and colleagues called 2-Team to Go, which are community team members who use the 2-Team model to assess the needs of people and communities and develop and launch customized technologies to meet their needs together. She was awarded the 2019 American Association of Nurse Practitioner Fellowship, the 2019 E. Louise Grant Distinguished Alumna Award, the 2018 Technology Innovation in Clinical Practice Award from Bayada Healthcare, and was the 2016 Robert Wood Johnson Foundation Clinical Scholar Fellows. And she is also appointed as the NCAA Emory University Faculty Athletics Representative. Next, I'm going to introduce Dr. Alexis Dunn Amore. Lexi is an assistant professor, tenure track at the school. She conducts research investigating the relationships between health behaviors, inflammatory mechanisms, and adverse pregnancy outcomes among high-risk populations. She is a certified nurse midwife who works in a variety of professional roles within the academic, hospital, and outpatient clinical setting. She currently serves in both a research and teaching capacity within the school, through which she's able to share her passion for clinical excellence as it relates to primary care, perinatal care, and postpartum care of women. Dr. Dunn is actively involved as the current vice president of the Georgia affiliate of the American College of Nurse Midwives, in which she actively participates on several committees focused on improving the health of women and families in Georgia. Dr. Dunn's career goal is to become an independent academic nurse researcher and leader who successfully builds a translational program of research integrating biobehavioral models into the prevention and management of poor pregnancy outcomes, especially among low-income and minority populations. She has received funding for her research and support for her professional development from the National Institutes of Health, the American College of Nurse Midwives, and the Southern Nursing Research Society. She has also published in a variety of peer-reviewed journals, including the Journal of Midwifery and Women's Health, Biological Research for Nursing, and Nursing Research. So if you all could please join me in welcoming our panelists. They'll take a seat up here, and then we can get started with some questions. Sorry?
Oh, I didn't know if there was a mic, but we just need to talk loud. For the people online.
Do we have a few minutes?
Let's talk loud. Okay.
Talk a little louder.
Okay.
Okay, so thank you, ladies, for joining us. I'm going to go ahead and start by asking a few questions, and Lexi, we'll just go ahead and start with you. Could you share us a little bit more about your work and why it's so important for you to speak out about your work that you're doing on a national and global scale?
Well, so for me, I guess the whole journey started with just wanting to tell stories and be an advocate for different populations. I was born and raised in Memphis, and a lot of things that I saw growing up, and it drove me into wanting to provide healthcare and to speak out for people who couldn't speak for themselves. And so the journey into nursing and research all stems from the fact that I just want to make a difference. And then so I've got a lot, what we didn't talk about on the bio, I've done a lot of media because I feel that it's important to be able to translate it back into populations where they can understand it. And so a lot of it has to do with just giving a voice to those who don't have a voice. And I know that with media, what I was taught when I've done trainings is you either narrate or be narrated. And I don't want to be narrated. I would prefer to be the narrator. So that's how I look at anything that I do as far as my publications or research or grants or any of the media spots, it's trying to tell that story. So it's kind of what's driven me.
Okay, Hope, same question for you.
So I think for myself, I started out, I'm a clinician at heart, and I started out by really being frustrated with the communities not having voices. So I found answers in that landscape through technology. So I started developing technology and realized, these numbers really speak volumes. The numbers that come through our data aggregators and other forms of technology or websites that are at your fingertips can become your community. And that's really what has happened. So I'm still a clinician at heart. I'm out in the field doing as much as I can in all communities. Using technology and being able to gather the value of technology and being able to put that immediately because of the real-time data, putting it back into the community overnight instead of having to wait 1 to 2 years or plus. It's an average of 3 to 6 years to get data and get it analyzed and back into the community. And by then, so much has changed within our communities that the data is somewhat irrelevant. So having that data real time has just been fascinating, and it's changed and improved so much of what we do as nurses, because we are the ones that are out in the field, as we well know, face to face with our community. So it's just been a great opportunity. And as Lexi has said, in the past with media and doing for certain things in the media has been a lot of fun. And it is, and thank you so much for your wonderful presentation about how we can have a voice in the media and how impactful it is. So.
Thank you. Okay, Lexi, you work to bring attention to health issues disproportionately impacting Black women, like the fact that Black women and children are still 3 times more likely to die in childbirth or in postpartum than white women and children. I know it took you a while to convince the national media that this was a story you had to tell. How did you finally bridge that divide?
Well, I think when I first came in, so my career has been a very traditional one. I did the undergraduate nursing, then the master's and the doctorate. And I've always been consistently concerned about health disparities. And so when I first was talking about maternal morbidity and mortality, it wasn't on the national scene like that. So for me, I was just using my local influence, working with the school. Like, if someone came to Rose or J. Miker and they said they needed someone to speak about it, I would just jump on the opportunities as they came in and would use that opportunity to share my voice. But the other part of that was just really taking that time to put it into my students, because I felt like, well, I can reach the media and they may or may not bite on it, but I know that I can help change the care of certain populations if I put that knowledge into my nurse midwife and nurse practitioner students and undergraduate students. So I would always tell stories. For instance, that's my daughter Aubrey right there. She's 10. So maternal morbidity and mortality was a story because I almost died having her. And I know some people say that they almost died, but I was very ill with preeclampsia with her. And that was a very traumatic experience. I knew that because I was a healthcare provider, I had a team of people around me that knew me, that really paid attention to me. I knew that that's probably why I was able to survive that experience. But that is what drove me back into research and advocacy and wanting to create resources for families to be able to help prevent or lower their risk at least for those kind of outcomes. So bridging that gap with the media was, or any kind of gap, was natural because I always, as most people in this room know, I always come from a very personal experience and I'm very passionate. And I don't fall back just because people are not interested or they don't like to hear what I have to say or they want to hear what I have to say. I'm not really motivated externally. It's more from an internal place of trying to advocate. And I think that is the thing that helps me bridge that gap.
Thank you for that. And I also have to say, doing that type of work, and then what I've seen is some people partnering, like I know Serena Williams was very vocal with telling her story. There's also the Kira story in Los Angeles, but it's definitely a story whether it's Kira, Serena, it could be Sarah, people we don't know experience these things. So thank you so much for continuing to share that story. Because I think once you share a story, it's not over. That's not the end all be all. It needs to live on. Okay, now Hope. Now your work lives at this intersection of issues impacting underserved communities, like people needing dental care in rural areas, and emerging health technologies and data and science. Your focus areas are both highly technical and underrepresented. What are some of the considerations others should keep in mind when pitching technical topics?
You know, I became a nurse because of some great influences that I was introduced to early on in life in doing work in Haiti. And I went to Haiti, you know, as I was in high school and started just collecting all kind of data. I mean, it was just one of those things that I wasn't a nurse. I didn't think I was going to be a nurse. I was like, that's the last thing that I'm really thinking about doing here. And I was just out there trying to figure out, well, we need to know how much is going on here. And that investigative discovery kind of approach, you know, set in. And I started just taking pieces of paper and writing things down as patients were coming through the clinics. And I took that and became very frustrated as I became a nurse. It influenced me to be a nurse, but it also was part of a great deal of my frustration as part of helping people. And how should we help people if we don't truly know how to customize our work to that community? And without having some of that investigative, you know, questions and, you know, that discovery to know more of what we're dealing with in the community, then it was hard for me to be able to connect as a nurse and say, well, what do I need to do here to pull in all populations, to pull in student nurses, to pull in other colleagues and peers to be able to improve this community. So technology became that answer. And over the years of using it, and you know, I've been a family nurse practitioner for 30 years, and doing this in so many different communities, whether it's international, local, regional, or national, it always works. The technology works, but you have to identify that the first step of being able to customize the technology to meet the needs of the community. And if you miss that first step, then you will find yourself drifting and not doing as much as you can and need to do for your community. So I think being able to slow down and assess that community and customize that technology for that community is key.
Definitely very important. So, and for either of you ladies, what do you wish all nursing students knew about the power of their voice?
What I wish all nursing students knew about the power of their voice. Well, one, that you have a voice. I think sometimes as a nursing student, it's easy to, you know, you're trying to get to the end and you're looking to your professors to provide this knowledge, and you can sometimes feel that you don't have one. But I always tell my students that you are endowed by Creator God with a unique voice that only you are given. So it's up to you to figure out how to use it. And sometimes it may not be clear right away. You know, you come from, a lot of our nursing students come from different backgrounds. They have degrees in many different areas and they're learning nursing. So they feel a little discombobulated, like they don't know who they are. But I always tell them that at some point, all those different trajectories will merge and will create a unique nurse that only you can be. And once that happens, it's going to be a little bit easier to know what that voice is. But just to know that if you don't know where your voice is now, it might just be that you haven't gotten there yet, but you will get there, and only you can have that voice. No one else can tell that story like you can. So just know that you have one and that you will find it. Just have to give it a little time.
So I'll tell a quick story that I think can put somewhat of a good path for us as nurses, whether we're just beginning or we're mid-career or retiring. But my mother passed away about a year ago from COVID, and she was a nurse practitioner. And the last nurse that took care of her, her name was Amanda, told me a fantastic story that kind of encompasses everything about our voice. And she told me that up to the last moment of my mother's life, that she was continuing to mentor nurses. And that's what my mother was a nurse. She was great at mentoring. That was pretty much what she was known to do. And she was still mentoring the nurse that was taking care of her. And this nurse, Amanda, had really struggled with whether she was going to continue to be a nurse because she was just so overwhelmed with COVID. She did not know she could do it another day. And she said, my mother looked at her and said, you know, you're right where God wants you to be. I feel angels in the tips of your fingertips. And you are expressing yourself, you're voicing yourself as a nurse just from doing that today with me. So I think as nurses, it's an example as nurses, we forget that it's the small steps we do, it's the fingertips and helping and touching our patients and helping them feel better from patient to patient, from day to day. That is the voice. If we can do it and magnify it in different environments and different landscapes, that's wonderful. But don't forget the importance of just taking care of each patient each day. And not everybody can be a nurse. Only a few of us are selected to be nurses. And it is extremely a blessing. So.
Thank you for sharing that. Looking back on your career, what advice would you give yourself on the first day of nursing school about overcoming the challenges and frustrations of your national advocacy work?
If I knew what was coming, I don't know. That's a loaded question. What advice would I give myself?
Yep. What advice would you give yourself on the first day of nursing school?
I probably would have told myself, because I'm very emotional. So even though sometimes I could present like a tough cookie, my feelings get hurt very easily. And I found that when you're trying to build a national platform or you're developing a voice or you've been seen as this person, that everybody's not going to like what you have to say.
That's true.
And you have to be prepared for the pushback, and it's not going to feel good. So don't put your heart on your sleeve every day. You know, it's okay to put your heart on your sleeve sometimes. But I think that the hardest part for me has been some of the pushback and some of the negativity that I receive sometimes by being myself. I'm mostly palatable, except for when it comes to issues that affect other people. So if I see something that is some kind of health disparity, some kind of overt racism, some kind of obvious mistreatment of another group, I have no tolerance for it. So I can be a little not palatable, and I don't apologize for that. So I would tell myself, just be prepared for that pushback that may come and that hurt that you might receive when you go up against big, powerful people, organizations, or anybody that does not agree with what it is that you're trying to do. But I guess I would do it all over again. I've had some times I've cried and times I've questioned if I'm in my right role, if I should be doing this, or should I just be quiet? You know, I've been told to put my head down, do your work as a nurse. And I'm like, what exactly do you mean by that? Because I am an advocate, and I'll always be an advocate. And anytime someone tries to deter me from that, I'm gonna push back at you. So anyway, I would just tell myself to just toughen up. Toughen up. I was very soft at first, very just cry about everything. And I have a sister, she's like trying to grow a pair, you know. So I was like, yeah, I need to grow a pair, you know. So now I'm a little bit tougher, you know, and just walk in my truth and don't hesitate and don't ever change who I am.
Yeah, you said a lot there, and I think that the fact that you will be met with resistance is probably inevitable. Because when you're doing something right and you're advocating for, especially in examples of underserved communities, there's systems and processes in place that need to be broken and recreated. And in doing that work, people will resist you. So you have to realize that if it were easy, everyone would do it, but you were the one that was chosen to do it and have the voice. So thank you for that.
2 words, persevere and patience.
Oh, good one.
Is what I would say to myself.
Good ones.
Keep saying it. And they're unattractive words, right? They're just hard, unattractive words. But I've learned over the years that you have to persevere. You have to have patience in almost every area of life, but definitely in our profession as nurses. And you know, keep sowing, just keep sowing, because you will reap what you sow. It will happen, but you have to find that common ground of just having, you know, being steadfast, being patient, being persevere, and just knowing that this is the world in which we live in. And as you are doing your profession and you're moving forward, don't give up, knowing that every time you are faced with a challenge, and you hear it all the time, there's opportunity, but it is the truth. And engage that opportunity and make it happen.
So much easier than
So
said
much-
sometimes.
So
Because I struggle with patience sometimes, because when you feel like you have a solution to a problem, and you know, you just want to get it done, but there's reason behind why it's taking the amount of time that it's taking. It needs to bake fully, I guess. Yeah. Okay. Good stuff, ladies. Oh my goodness. Okay. Now, what is your best pro tip for building a national media presence?
Best pro tip for building a national
Yes.
media presence. Take the opportunities when they come. And they don't always, like you said, present. Like Rose has emailed me, so-and-so wants to talk tomorrow, and I'm like, oh, my hair is not done. Same thing. What am I going to, you know, you think about all these things, but like you said, media is a timely thing. And I think as a scholar, I'm accustomed, at first when I first started, you know, you have this long amount of time to write a manuscript and all that stuff. But you have to take the opportunities, and I think that is what has helped propel me as far as getting, like I said, the TV media or the radio. When they ask me, I just say yes, if that's what you really want to do. And then I would say, listen to like the journalist and whoever's interviewing you will give you good tips as far as like how to do sound bites and how to talk in shorter sentences so they can use what you're talking about. So listen to them as far as, you know, they're the experts in trying to tell the story. And then just be yourself. I think, you know, I've talked to some professors that want to do it, but they are like, I don't know if people imagine what they think media is like, but I'm like, it's not like that. You really just have to, the camera is there. So eventually just act like the camera is not there and just talk to the person interviewing you. And just be yourself, just tell your story. Dr. Gupta, I don't know if y'all know Sanjay Gupta, he's here at the School of Medicine, very well-known media health journalist. And he was doing the training, and what he said was, when you're telling the story, when you have to know your facts, one, like he was like, you know how you have a kind of a bell curve? There are always gonna be people on the extremes, and you have to just work on the movable middle when you're trying to tell a story. So just focus on the movable middle and just cater to that particular audience. Don't worry so much about the extremes. And then like I said, just be yourself. That's kind of all I've done. I don't really feel, I mean, you're nurse out, be nurse out. I haven't done anything to the level of what you've done. I've dreamed of doing that, but just like Lena said, when you're a full-time professor with research and all that, you don't quite have the time to build that personal brand. So I have just leveraged the opportunities that come through the university. The school knows that if any specialist comes to the school to talk about anything maternal child health, they're going to come to me straight off. Even the main Emory knows that. So just use the resources that are at our fingertips as professors until you can do your own kind of individual thing.
Okay. And don't worry so much about the hair, right?
Oh, don't worry about the hair. You know, just hold your head a certain way.
Well, let me just say, this is a fun tip. So yesterday when I got that phone call, I had my kind of hair wrapped up. I didn't have my lashes on. I just like was just, I was getting ready to lay down, and then what pops in my head is, is that really the most important piece? Because what I say can potentially impact the health of thousands, actually millions of people who are watching television at that moment. And so just know it's for a quick second, you'll be fine. You know, just do some of it. And smile. It's about the smile.
Right.
Yeah.
I'm like, listen now, you trying to put a black woman on TV, you need to give me a couple of hours at least, like, call me in 30 minutes. So you did good.
Yeah. No lashes, but I have lip gloss on. Okay.
So, you know, in what I have done in media, it was hard. For me, it was hard. And it's something I started out in the mid-90s doing it. And I was here with a local channel, and it was an Ask the Doctor segment, and did it for about 6 months. And it was, a lot of fun to learn the ropes and to get behind the camera and in front of the camera and figure out, what all that camera's doing. But it was tough work for me. And I found it to be challenging in a way where you really have to think about, like what you're saying, there's Alice, there's so much you can worry about getting in front of that camera, but keeping a focus of the value of your voice and what you've done in your life and how that deliverable can change and improve people's lives has to become that streamline and continue to do why you're doing it. This is the reason why you're doing this, and not all the other things that can come in play, and you start to drift and think about this and think about that, and it can be a little bit overwhelming. But media is something that, especially with social media, I have not done much with social media other than my platform, my website platforms. I really don't do much social media. But I think it is, I was just talking to a team, we just found out that we had the Delta Dental grant for oral health care. And I was just talking to the team about how are we going to start to expand and share information in the social media world. And I think that is really a question that many of us are asking. So it'll be interesting to see what happens.
Yes. And I think outlets have been trying to figure that out as well. And especially when we were with the pandemic, when many people were home, they were watching their television, they were on their devices all the time. So really, the two are beginning to really complement each other. Social media is really, as far as sharing research, health information, and getting all of that out there, social media has been a great complement to that, with sharing it in bite-sized pieces of information, and as well as engaging different groups, because there are certain groups that are on Facebook and certain demographics that are on Instagram. And so it's really very powerful once you understand social media. And as we talked about, catering your message, customizing it to the demographics that's most impacted by it, that needs to hear it. Understanding those groups and the types of conversations that happen on those various platforms can really amplify your message even more so. We talk about going viral. You don't go viral on television, you go viral on social media. So, it's kind of one of those, you want to do social media work, but you don't, because it's a lot. It's very time consuming. But once you understand it and you can harness the power of social media, it can be a great tool with helping to disseminate important information.
I agree. I like Lena asked, I stop my platforms all the time. I have this Dr. Alexis the Midwife. It's got all this little website, and then I get a grant come in, and I was like, my life is over for 6 months. But then I realized that there are things that can push the content out. You can build, I can schedule it to release into these platforms, and if you just had a little bit more time, but they have things out there that can help you as far as timing the release of your post, and so you don't feel like you have to release every single thing. I don't know if you have experience using some of those.
Social media managers. So you can pre-schedule, let's say, like for Heart Month, I got 30 stats or 30 things I want to talk about heart health. I'm going to schedule it to release one every single day. So I'm engaging and educating every day, even though I'm not personally doing it, it's already been scheduled to do so. So those are great tools. Again, harnessing that power and kind of pre-planning, that's really helpful. Now, how did you ladies get started? with your media stuff? It just.
I think the first little bit really was through the school. I mean, I can't remember how it started. I think we had our school nursing communications team. I like to talk. Everybody knows that. I'm talking constantly. And they're kind of like, you should consider doing this. And like, and TV and radio are two different things. And I think I like TV better when it's pre-recorded, because I know they're going to cut it up.
Pre-recorded.
Versus, well, you know how they record you and then they're going to make the story. So if I screw up, I'm like, well, they probably can cut that part out. Versus like radio, it's like, this is going out like right now, I think I got started just with the school's opportunities. And just like I said, every time they would ask me, I would just jump all over it. But I think media was always something I was interested in because I like to talk. And I think if you can talk and engage, I mean, why not? So that's kind of how it started. And like you said, I have my personal goals, but it's really hard. I have 2 young children that are home in and out with the pandemic, and you got your responsibilities as an academician, and it just doesn't leave a lot of time. But I know it's really important. You really can't change things if you do it. So maybe one day.
For myself, I think, like I mentioned, I was working down at the Georgia Nurses Association on the prescriptive authority, and I was leading the coalition, and they needed someone to come in and just do a segment on that content. So I said, okay, I'll run down to the Capitol and do it. And I did, and then that's when the local channel came in and asked for me to do these segments. Which, as I said, it was a lot of fun. Once they stopped doing the segments, I didn't reach out. I didn't pursue other avenues to do any type of media. But I always kind of kept my foot in the door when, they want some kind of feedback for a publication or an article. I've done radio, but I think the value that I do see more and more in media, especially since I started doing the technology component, which has been about in the last 11 years. And that just kind of fell in my lap. I am not really technology savvy at all. It's just one of those things that started in my DMP project, and I realized what a great need there is for it. So I've kind of played with it here and there, but the media outlets that have come to me to ask me questions about technology often don't even know the questions to ask. And that has been very interesting because it is something that is new, is something that is, not many people, like I don't have a blueprint on developing apps because there's not, at the time when I first developed my first app, there wasn't many nurses developing apps. And my first app was pediatric hypertension in an area that we don't even, really allocate that many resources. We're getting there, we're doing much better. But 11 years ago, plus, really not much going on there. So a lot of what, you do with media and as a nurse, you may be the pioneer, you may be in an area that you're so uncomfortable and you don't know the next step to take, but trust yourself, believe in yourself. If you believe in the content and you're passionate about it and you know that you're on the right path, take those steps and do it, accomplish it.
So when you take those opportunities, like how, we have a school of nursing podcast, I'm one of the 4 personalities on there, which I think is really, when you're doing it on a more regular basis, like you said, you kind of get used to the media team behind the scenes. And, I still get the nerves when they're like, okay, countdown. And it's just all these things that you're not used to, but as you do it more, it kind of grooms you. So if you're interested, I would say, even for students, I know we're still brainstorming future episodes, but we do plan to bring students on board, try to get on some of those podcasts or just get involved in some kind of way. Like how you saying you've had this idea forever, just small steps, like brainstorm the idea, start looking at the platforms you can record, because you have to build the show and make the show. So part of it is coming up with the content. The other part is the music and the logo and the, how the show is going to be produced. And that's, I think, one of the deterrents for me personally. I'm like, I am not a producer. I don't have a clue about all that, but you have we have a communications team here. J-Mike has a wonderful team, and they could, you're in here in the school of nursing. Those are resources that you have at your fingertips to show you how to do that, or at least connect you with people that do the production part of the podcast. So make use of the resources that you have right here at Emory, while you can.
Thank you for that advice. And what we spent a majority of the day talking about is the nurse as the health expert, sharing the research, the evidence, and those type of things. And what you just kind of segue into is the production. So sometimes people come to us to complement a story or tell a story share your research. But now, as we move forward, there will come a time where nurses will need to learn the production side, so we can then be responsible for creating the content we believe is necessary. And while we've been talking about more like news type of radio, TV type of platform, not saying that this is where we exactly need to go, but many of these scripted health programs, people look at those as still educational opportunities. And what's actually the reason why I was listening to you and I thought about this, I actually had the privilege of being a nurse consultant for the Fox's The Resident. And I don't watch the show too much, but they created a new grad nurse. That was based on the conversation that I had with them about developing this character. And then once I thought about it, I thought, that's how that works. And so we don't know, we're not in these spaces. I got the writer, and her first name is Amy, the creator of the show. It was an event, and it was about maternal mortality, and she was speaking because they were doing the Kira episode. And then it was a Twitter chat, and I told you Twitter's where, and I'm engaging in Twitter, and I'm talking, and then next thing I know, she's like, "Oh, hey, Alice, thank you for being a part of the conversation. I see you're a nurse. If you're ever interested in, talking with us about nurses, let us know." And I took her up on that opportunity, and next thing I know, I consulted on the creation for that character in a couple episodes, just how nurses respond to it. And I have colleagues, because I'm from Los Angeles, who actually are consultants on set. We've seen the ET tube placed incorrectly. We've seen, and so nurses are really, in addition to telling the stories, are so critical at making sure that the depictions of healthcare and what nurses do in the media, all forms, even if it's entertainment, we're needed in those spaces. So you talked about production. So creating a podcast, being the producer, maybe you become the producer to greenlight your own scripted medical show. Maybe you greenlight a talk show. There's the doctors, maybe there's the nurses. The opportunities are endless, but I think we need to start thinking this way because we don't think like this in nursing school per se. And I'm rightfully so, you gotta learn how to do blood pressure and all the basic stuff first, right? But as we evolve, we need to harness the power that we have as the largest segment of the healthcare workforce, as the most trusted profession. We have the potential to make a lot of impact if we do these things. And I think we just, as we move forward, we need to start brainstorming these ideas. What does this look like? And how could we do this? And, who knows? I mean, and there are nurses out there who are trying to get on the front and being in production. But I just think that there could be so many more of us, and the stories that we could tell. What maybe you do a Netflix documentary on mental health in men or something like that. I'm just throwing out ideas, but the opportunity to educate, share your research, really break down some very complex topics in science to help educate, the end users and the consumers. There's so many different ways that we can do that these days. So, all right. Anyone else have any questions?
Could you all give your emails and any social handles you want the audience to know about, so if people want to connect with you afterwards, maybe do some networking, they can do that, especially for people who are zooming in from elsewhere?
Sure.
Well, they know her. They know Nurse Alice's information. So I have several social medias, but I'm an Instagram, Facebook person. And now that you talked about Twitter, I always shy away from it because I'm like, it's so newsy, but I'm like, I guess that's what it's for. So Lexi the Midwife on Insta, Facebook, and Twitter. And I'm also Dr. Lexi the Midwife on Instagram. So I'm trying to build that as my brand.
Okay.
And mine is PDBP on Twitter. PDBP. It's like pediatrics, PEDIA, and then blood pressure, BP. And we also have OICAN, which is oral health in communities and neighborhoods. And it's on Twitter as well.
Okay. Wonderful.
Alice, any others you want to share?
No, I'm on social media and everything is Ask Nurse Alice for me. So Ask Nurse Alice on Facebook, Instagram, Twitter, website, everything is Ask Nurse Alice. So I make it easy for people to find me.
Awesome. And J Mike, I think is saying that we have a question in the
Oh.
box somewhere. Do
Okay,
you want to
great.
do that?
Yes,
In the
okay,
Q&A box.
wonderful. Okay. Question from Priscilla. How do you find an outlet for some of the issues that you would like to speak about? I have a number of maternity-related op-ed essays about care during labor, water birth, research, or midwives' ability to impact the maternal mortality problem. But I don't know where to send, so I will get the writing to the best possible audience.
So
So,
she's asking where to pitch?
yes, that's called pitching.
Okay. I'm not the expert on pitching. I mean, I did an op-ed to change the world. And so Priscilla, I could send you their information because when I was in that phase of training, they had a full list of journals, not journals, media teams that you can contact. And they had it broken down by different areas. So I can put you in contact with those journalists. I haven't written an op-ed recently, so I'm not exactly sure where you should pitch right now because pitching is a time-sensitive thing. A lot of times they say you want to hook it on to some current event. I don't know what topic you're trying to write right now, but it's very helpful to have someone to help you draft it. And I forgot what it is, a hook or something, like some kind of current event that you're doing to tie your topic to is a great way to know who to pitch it to and how to pitch it. But I would say that I could just send you the information to those persons and maybe they can guide you on who to pitch to.
We've used the term newsjack. So meaning like if there's something like, let's say Serena, we're in the hospital now and having some issues with her labor and delivery, that would be the prime time to get those messaging out there when you can kind of ride the coattails of a current high profile story, high profile person. That's always helpful. Now I know sometimes there are times where there's just there's nothing to hook it to. So I think in those cases you look for the outlet that has the audience that you're looking to share it with.
Right, so if you're looking for, say towards Black women, you might be like Essence Magazine, or you might want to look at some of those more BET, like some of those kind of media outlets like that. So it will kind of depend on what you were writing.
Yes, and I just wanted to just piggyback on that. As health professionals, as nurses, sometimes, we've always been encouraged to publish. And many times that's in our peer-reviewed journals and, that's a great thing to do. But I experienced that sometimes in my journey that when I would write for Black Enterprise or Essence, it wasn't viewed as equally as important as some of my peer-reviewed contributions. And I just want people to know that that's okay because it's the consumer who's getting information, so you're still making an impact. So I think sometimes while being published in a peer-reviewed journal is very important, it's a great accomplishment, do not underestimate the power that you have by writing for more commercial or entertainment type of outlets or forums, because there are consumers there that are consuming that content, and they are like everyone else who needs healthcare, have health issues, and can benefit from the information that you have. And again, I tell people I like to talk to people before they become my patients. So wherever that is, before the ICU and the ER, because once we're there, that's a whole nother conversation that we're having. So I think some great questions.
Can I add something to that
Yes.
comment that you just made? My first editor, when I was transitioning from like that peer-reviewed voice to the consumer voice, and it was challenging. She actually told me to read Cosmo, like go and read the health section of Cosmopolitan magazine. And I was like quietly in my mind a little insulted by that. I was like, I have a Bachelor of Science in Nursing. I do not need to read Cosmopolitan magazine. But I did, and you see how different the voice is. You see the length of the sentences. You see the fun stories that they put in there, like the quirky, pop culture references, and you remember it. And sitting there as a nurse, thinking about the same topic in a peer-reviewed journal versus in Cosmo, I remember the stupid anecdotes from Cosmo a lot more than I do from what I read in the journal. And think about the reach of those magazines. Think about the reach of Very Well Health and, maybe things that you would consider like some people might call like Dr. Google. Think about how many people see that versus how many people see a journal, and you can do both. But it's really important to do both.
How many of those peer-reviewed journals do you see in the airport on the shelves
Yeah.
when you're going, right?
Yeah.
And that's what I try to share, because I'm a researcher, y'all know I do research, and every time I sit in a meeting, I'm like, oh my God. Okay, so what about the patient? Like, they're not gonna read this, so how do we put it here? And that's a branch called translational science. For all of you that are gonna go back and get doctorates, so this is my pitch for doctoral education, because there's a way to do what she's saying and do it in a way that you can put it into the journals for the scientists, but your job is to translate it and make it palatable to the masses. And there's a whole process of training that teaches you kind of how to do that it's a full scientific method or skill set that you can acquire. So I'm the same way, because I'm like, they're not going to read that. That can just get published. It'll get you notoriety. But one of the questions I've asked myself recently I'm a spiritual, I'm Christian, a sermon that I heard, and we were talking about your desires and what it is that you're trying to do for your life. And it's like, are you doing things in your life to be noticed or to be known? And I think sometimes as an academic, I found that we're publishing because you want people to notice, like, oh, I'm doing all this work. But for me, it's more about being known for doing things to change the health of people. So like she's saying, if you're publishing in Essence or wherever, it's like you want to be known as she's done, I'm a leading health expert, I'm telling you the facts, and I care about you. So if I have to put that in the news story or in a Essence magazine, wherever it needs to go, however it's going to reach the person to help them is what she wants to do. And that doesn't always get you the accolades or for me, sometimes the tenure that, some of us are chasing. You may not get there doing some of these things, but you have to look at you have to define your own success, I guess. What is it for you as an individual? And that's kind of where I am. I'm at a little bit of a crossroads of identifying who I am as a nurse, scholar, and scientist, and what my impact is and what's most important to me.
Yes.
So do you want to be noticed or do you want to be known? You have to just decide.
Because I put my popular publications on my annual as clinical nurse specialist, and they're all about cardiac issues or cardiac clinical, but I had this long list of popular outlets and, still health related, and a long list. And so, when you go in and do your annual review, it's like you list all the things that you've done, and then you come out with recommendations and goals for next year. And my goal for next year, well, I didn't pick the goal, but the goal that was selected for me was 3 peer-reviewed articles. And so that's how I firsthand experienced that. And I have to be honest, it let some steam out of my, what's the saying?
Steam out of your sails.
Yeah, it did, because I was thinking, I have impacted millions of people who read this content. And yes, and I had been writing, but this is just what my passion, my fun. This is like, these are even things I did after work, outside of work, my volunteerism, my community activism, and they just weren't as appreciated. And mind you, this was probably like 8 years ago. So I think tides have changed a little bit. We're starting to better appreciate those outlets. But just early on, I had some of those lessons, and I had to decide, as you mentioned, do you want to be known or noticed? And what I really wanted to do is make an impact in the community as a community health advocate. And I had to be okay with what I perceived as an accomplishment versus what someone else deemed as an accomplishment. So
I think also we need to try to look at what we do. So Rose, I love what you just shared with other industries, and what does the world look like through the lens of other industries, and how can we better connect? Because many people don't know what we do as nurses. They, from day to day, unless you're a patient in that hospital or in that clinic, you often do not know the depth of the nurse. And I think if we can broaden what we do and look at things through other industries, and I often do that through sports. I'm the former D1 basketball player. I love basketball. I will always love basketball. I always will coach. I will always have my foot in the door on the court more than I'm in the classroom. Don't tell anybody. But it's true.
That sounds like a great article.
Yeah, that's true. So I see this world, and as the faculty athletic rep here, with working a lot with NCAA, I see the world so differently now in how we are able to communicate and continue the conversation in what we do as nurses. So I think it's important for us to try to see the world in a different way, see the world through different industries and not just through nursing. And I think that's sometimes where we may not do ourselves as much of a favor as we should.
I agree with that.
Something I'm just realizing really kind of late in my career. It's true.
It is.
Yeah.
Nursing, we're really good at all of our nursing stuff, right? We're on our nursing groups. But when it comes to being at the table of other organizations and something as simple, and I'll share this. When I moved to Los Angeles, I wanted to learn the city, so I did the Southern California Leadership Program. And so it teaches you everything from, we did tours at the correctional facility, understanding all the dynamics there, public transportation, the buses, and we were like at the airport looking at how we can improve things for the community. And every field trip we went, I had a health question, and the leaders of the program were like, "You never had a nurse in here. You're asking some really good questions. We gotta put this in the program for next year."
Yeah.
So I mean, it goes to show you that people don't really when we come to the table, when we work together with others, we can collaborate. I mean, we can synergize so much more because we have this nursing hat, but people view things differently, or the things that are standing out to me as potential health issues. So I had a question about public transportation in the prisons. Everything was about sanitation for me. I'm like, even anything was like sanitation. Well, how do you guys keep this clean? And how do we get this from here to there? And they're like, you know what? Oh, I don't know. But, it's a little bit, I mean, I stepped out away from media, but it's just to complement what you said about, really realizing that people see us, other professions or industries see us differently. And we really need to acknowledge that and then find different ways to contribute and to add to what's already being done. Good stuff.
Any other questions?
I just have a quick comment. First of all, thank you all so much. This is such an informative session. I'm not a nurse. I have a master's in public health, but I work for a nurse researcher who's actually one of the PIs on creating a mobile app for postpartum women to sort of blending in some of the experiences here. But I felt really moved here. I was actually just I have been motivated to reach out to a high school friend of mine who is now a news anchor for one of the populations that we are actively recruiting for our research study. And so I just got word back that she's gonna pitch that to her producers. So
Nice.
just wanted to say thank you to you guys for just giving me that sort of idea to sort of do that. So hopefully, fingers crossed, it works out and we're able to sort of recruit from this population using television media. So yeah.
You work with Dr. Chandler, right?
Yeah, Dr. Chandler, exactly.
Yeah, and Rashid and I are really good friends. That's another thing. Like you said, you have to find your tribe. I always talk about that in a general thing, but it's the same way within this nurse world. You find your tribe, and so I know Rashid and I have bounced ideas. It's like so how are we gonna get into the people that we do the work for? And so I'm so glad that you again advocating for the populations, and even though you're not a quote nurse, it's still public health, and breaking down those silos of I'm this, I'm that. Yeah, you can identify as a nurse, but at the end of the day, it's about making a difference. And so the more you can collab, like she said, across institutions, the better. So keep us posted on what happens.
Yeah, definitely. Fingers crossed. Hopefully, they'll see us in Albany.
Yeah.
Very good.
Awesome.
Good stuff. Any other questions?
Well, thank you all so much for coming. Thank you for spending the time. We have some time built into Alice's schedule for her to just chat with people for the next little bit. So if anyone wants to speak with her personally, speak with any of our panelists, speak with Lexi or Hope, please feel free to stick around. Or if you're joining virtually, please do reach out to our speakers via social or email to keep the conversation going. And of course, if anyone is interested in working on building their media presence or building their personal brands here at the school, don't hesitate to reach out to Mike, Shamuriel, or myself, and we can work on a plan with you individually to see where the best place is to reach out to folks, attract new audiences and things like that. So why don't we give everyone another round of applause and